I'm here with Dr. Bloomfield to set out the process and time frame for the ramp up and rollout of our vaccination campaign to everyone aged 16 and over in the second half of the year. Our goal today is to first provide you with some greater guidance on when you can expect to be vaccinated, and secondly, what the process to arrange your vaccine will look like when your turn comes. But first, an update on where we are today. Our vaccine plan started by targeting our available vaccine to those at highest risk. Protecting those at highest risk gives us all greater protection. Our frontline MIQ staff all have to be vaccinated in order to go to work. That work is completed for existing staff and is ongoing for those newly employed. Other groups at higher risk include those aged 65 and over who have been steadily getting vaccinated. We are closing in on 1 million doses of vaccine being administered. This sees us ahead of our plan at around 107% of target, meaning we have to be careful not to get too far ahead of available supply in the coming weeks before the bigger shipments arrive in the second half of July. This is ultimately a good problem to have. Over the next 5 weeks, our focus is on vaccinating over 65s, with around 500,000 vaccinations planned. This is, in total though, a very big group, over 1 million in total. Different DHBs are in different stages of moving through this group. I can assure you they are making progress, and we will reach everyone, albeit at slightly different paces depending on where you are in the country. From the end of July, we will enter a new phase of our vaccine program when we start receiving the bulk of our vaccines and are able to broaden the rollout considerably. There are some caveats here that I want to share. We know we'll be receiving more vaccine than we have to date, but we still won't get all of our supply at once. The deliveries will be weekly, and we'll receive roughly 4 weeks' notice of the size of those deliveries. What we do know is that we will receive the bulk of the supply we need to vaccinate every eligible New Zealander by the end of October. What that means in practical terms is that our vaccine campaign will take us through to the end of the year. It also means we'll need to stagger our rollout in the most practical way possible. For lessons on how to best do that, we've looked abroad and also at our own needs. Today I want to share with you what that rollout looks like. First up, I can confirm that we will be rolling out the vaccine for the general population using age cohorts. That means it will help us manage both demand and supply, and also that we'll be able to communicate nationally when we're ready to start vaccinating the next age band. Secondly, when we announce an age band, they'll be able to use our national booking system to book an appointment or contact our national vaccine call centre. This process will start officially with those aged 60 and over on the 28th of July. We know enough about our supply to also announce that on the 11th of August, New Zealanders aged 55 and over will be invited to book a vaccine. From here, the rollout is indicative as we wait for exact details from our supplier, but we broadly expect that for those aged over 45 years, we'll be looking to open up invitations from mid to late August, and then for those over 35 years from mid to late September, with everyone else generally being eligible from October. We've landed on age bands because it's a simple approach most commonly used overseas and because the risk of COVID increases as you get older. I should add that once your age band is announced, there is no cutoff. You can be vaccinated from that time on at any time, but the sooner the better. I now want to step through the booking process. When it's your turn for your age band to be vaccinated, you will receive an invitation from the Ministry of Health to make a booking. You'll get this invite either by email, text, mail, or by phone. Your invitation will ask you to use BookMy Vaccine. As you can see, the new national booking tool will be used to book your first and second dose. It's an easy to use, accessible tool. You'll be asked to choose a location that suits you and then to choose a date and time for both vaccines at the same time. For those who may not wish to use web-based services, we'll also have a phone line, a new national vaccination booking call centre. These services will both be up and running from the 28th of July, ready for that national rollout. As I said, you'll be asked to book both of your vaccinations within a 3-week gap between them, and this does differentiate our rollout from many other countries who aren't necessarily having those two bookings occurring at once. Now, at any given time, the health system has up-to-date contact details for more than 90% of people in New Zealand. That's pretty good. But we absolutely anticipate that there will be people who, when their age cohort is announced, for whatever reason, may not receive their notification. That is why we'll be making sure we've got a solid campaign so people know when they're eligible, and they'll know how to contact us to book their vaccine if they don't receive their invite. Everyone will have the chance to be vaccinated. For those who are worried that their details may not be up to date or who just don't want to miss out when they're eligible, from the end of July they can visit BookMy Vaccine and register their details. Once bookings are open for your age group, you'll then be sent an email or a text letting you know it's your turn to book. This is a really good backstop measure for those who may not have heard from their health provider for a while or are worried that they don't have their up-to-date details. Finally, while age cohorts will be the basis of our rollout, we'll also be undertaking measures that take into account our population. In August, we'll start using work sites for vaccines that especially have a workforce that might otherwise be harder to reach. The Ministry of Health is currently consulting with large New Zealand businesses and Business New Zealand on exactly who will be involved and how it will roll out. But companies such as Fonterra and Main Freight have already indicated that they're eager to be involved. We'll also run mass vaccine events to make sure we're reaching those we need to. These events will especially be focused on high-risk groups and equity issues. There will also be examples of rural or isolated communities where it just makes sense to vaccinate the entire population as once, such as the Chatham Islands and remote places like Reefton and Tolaga Bay. Remember, this is the largest and most complex vaccination campaign New Zealand has ever run. We'll keep making improvements to the system as we go, as we've done the whole way through our COVID response. But we also need the team of 5 million to play their part too. Just as in 2020 we stayed home to save lives, in 2021 we need to get the team vaccinated to save lives. Getting as many people in New Zealand vaccinated as possible will ensure we retain our hard-won freedoms and keep that place, that proud place that we have as one of the few countries in the world without COVID in the community. While the vaccine will become your individual armour against the virus, ultimately this is about whanau. It's about looking after each other and ensuring our loved ones are safe. Each of us getting vaccinated means someone we love is safer. So my final message is do it for those you love. I'll now hand over to the Director General of Health, Dr. Ashley Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So, as the Prime Minister has said, our COVID-19 vaccine rollout is a huge undertaking for the health sector. Just under 4 months ago, the first person was vaccinated in New Zealand against COVID-19. Here in Tamaki Makaurau, and as the PM has said, we are slightly ahead of plans and closing in on a major milestone that we're expecting to hit sometime next week of 1 million doses of the vaccine being administered. That means between now and the end of the year, our goal is to administer a further 7 million doses to people in New Zealand. As we have been working through the first 1 million doses, we have also been putting in place the health system infrastructure needed to operate at scale. You may remember it took just under 7 weeks to deliver the first 100,000 doses, and we're now delivering more than 100,000 doses week in, week out. We're now preparing to ramp up to around 350,000 doses a week, and on some days at the peak of the delivery, that will be up to 70,000 doses a day. We are on track to have a significantly upscaled vaccine system in place for the start of Group 4 in late July. This includes our 17 new ultra-low temperature freezers, allowing us to store up to 4 million vaccine doses at any given time, which will include the new Southland distribution hub based in Christchurch, which will be operational in July as large consignments of the vaccine arrive, and they will be able to fly in directly to both Auckland and Christchurch. Our distribution networks reach into every part of New Zealand, as the Prime Minister has said, including the Chatham Islands, where vaccination will start at the end of this month. We will continue to increase vaccination sites. At the moment, on any given day, it's usually between around 80 and 150 sites. We will be scaling up to over 800 sites at the peak of the program, just to make sure we are able to deliver the vaccine at scale right across the country. People will book using the BookMy Vaccine web-based tool, as the Prime Minister has explained, and this is designed to manage a high volume of bookings and registrations and is backed up by a dedicated call centre. Our goal is to make it as easy as possible for New Zealanders to book their vaccine at a time and location across the country that suits them. They will be able to log back in to change their appointment, either the first or second appointment, and after the vaccination, the information will go to their GP about the fact they have had their vaccination, as has been in place right since the beginning of the program. BookMy Vaccine has been developed with input from district health boards, general practice and consumer groups to ensure that the tool is easy to use, is resilient and fit for purpose. It will be the main system for people to book their vaccine once Group 4 starts to roll out. Historically, we have not had a booking system nationally to book for our vaccines, either in childhood or as adults. So this is a new venture for the country. There are challenges in building a national system. For example, one of the reasons we are rolling out gradually to district health boards is many of them, of course, have their own existing booking system with bookings on them, and so we are having to migrate increasing amounts of data across to the new system. But we have had very positive feedback from consumers already, and we waited until we had piloted it in 2 DHBs before we rolled out further, taking into account feedback from consumers and others. There are currently more than 26,000 active appointments in the new system. In closing, I want to echo the Prime Minister's comments. Our best chance for long-term success in controlling COVID-19 and maintaining our current elimination approach is to have as many people in our population vaccinated as possible. So I personally encourage anyone who is eligible to book themselves in for their COVID-19 vaccination when it is their turn. The high and growing level of interest in being vaccinated in New Zealand is hugely positive. And I ask you to also be patient. We do expect high demand. That's a good thing. We can't vaccinate everybody at the same time, but we have enough vaccine and we have the infrastructure and the workforce in place to ensure that everybody is able to be vaccinated before the end of the year. Together we can protect each other, particularly those at most risk in our communities, just as we did last year. Let's keep acting in each other's interests. It's served us very well to date. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Now, just before we open up for questions, I understand that the Ministry of Health will be conducting a more fulsome walkthrough for media next week at the Ministry of Health. That will be an opportunity to share a little bit more detail on the BookMy Vaccine tool, but also to give a little insight into the logistics that sit behind this very significant vaccination program. But for now, happy to take questions.
How long will this realistically take?
So based on the delivery and the supply of vaccine, we're working towards it taking till the end of the year to vaccinate all those who are eligible. And that's simply because we are vaccinating as many people as we can based on the doses we have, but we won't be receiving all of our doses for everyone until the end of October. So that's why it'll take us through to the end of the year.
And
Is
we
that
need
later
to
than
be
expected,
doing-
Prime Minister?
No, that's exactly as we've expected. You will have heard us talk consistently about the vaccination program taking us through to the end of the year.
The October delivery
Oh, no.
could evolve?
Oh, actually, that is a little bit earlier than perhaps we'd anticipated. But, of course, once you receive it, then you need to work through that distribution. So, broadly speaking, the year.
When you say that you will get about 4 weeks' notice of the volume of the delivery,
Yes.
what's the backup plan if there's any issues?
We're
with delivery?
confident, based on the conversations we've had with our supplier, that the rollout schedule we've broadly set out today will match the supply that we receive. But the reason we haven't given more specificity is because we will still be working to a 4-week notice program. So, broadly speaking, we're confident about those dates, but any more detail than that, we are going to have to wait for that 4 weeks notice.
Even so, though, the Auditor General said that you should have a backup plan, so what is the backup plan?
We do have, of course, other suppliers for vaccine, but there's no suggestion to date that we won't be able to, as planned, fulfil our ambition of having a predominantly Pfizer-based program. We've got a good relationship with the supplier, and to date they have continued to deliver as expected.
How far off is approval for the next vaccine?
So the independent committee met earlier this week on the 15th to assess the Janssen vaccine. They're getting some further information from the supplier, and we're expecting that there will be a decision by MedSafe around approval within the next week or two, and then that will then be given to our vaccination technical advisory group to provide advice around the decision to use. But ultimately, the decision to use is with Cabinet, and our intention is, once that decision's been taken, then we're expecting deliveries from August, and if that approval is given, of the Janssen vaccine.
And
Yes.
so previously, obviously, you anticipate that Janssen will be the one that gets approval next in all likelihood?
That's right, yes. That's the one that's furthest down the approval process. We've also got AstraZeneca still in that approval process. We're waiting for more information, which particularly relates to the manufacturing, because the doses that AstraZeneca is providing for New Zealand are coming from a newer plant, which is in the USA. And so we're waiting for those data. And then we've still got, of course, Novavax as the fourth in our portfolio, which is on a slower timeframe.
Well, we need to start
Yeah.
booster shots.
So,
Are
sorry.
we anticipating people to take different vaccines, receiving 2 different vaccines?
We haven't been planning on that basis. As we've always said, we have enough doses and supply of Pfizer coming into the country over the course of the coming months to offer it to all of our eligible population. However, of course, we entered into these agreements very early on, before in some cases clinical trials were completed. So the reason we have that diverse portfolio is because in those days it wasn't entirely clear at that point who would be manufacturing earliest and who would complete approvals earliest. So that's why we still have multiple in place.
Well, we need to start booster
I'll let
shots.
you just finish and then I'll come to you on
Yes, a
boosters.
separate matter. What issues have come up in the pilots of this program?
I'll let the Director General speak to that.
No particular issues, but there are we've had lots of advice on ways we could improve the user interface, including from senior cabinet ministers and the Prime Minister herself. So, I mean, the process we've taken here, and this goes back also to how we developed our national contact tracing solution last year, which is on about its 25th iteration, is to develop something and then put it into sort of a limited circulation and get feedback on it and iterate it a number of times. And so what you're seeing now and what will be rolled out as the BookMy Vaccine interface has been through a lot of testing, piloting, finding out issues around making sure that the language is really clear, but also the interface with other systems, other information systems.
Some of those examples that people have given in the feedback, what's been the majority in terms of what...
The Prime Minister can share
Look,
her feedback.
I can't speak to what users or DHBs have sent through to the Ministry of Health, but certainly when we had a very quick run through, some of our suggestions were just around simple things like simplicity of language, explaining that the reason we're asking whether or not you've received 1 or 2 vaccines yet is because 2 are required. Just very simple things to make the user experience as simple as possible. Yeah.
I mean, we need to start
Yep.
the booster shots before the first round of jabs is complete.
More a technical question for Dr. Bloomfield, but I would note that No country is in that space yet, and all of the conversation that you hear from pharmaceutical companies really is just an acknowledgement of the fact that, as we've always said, we anticipate that, as we do with the flu, that COVID-19 will be something that we continue to update our vaccine program as we go. And that is exactly the same thing we do with flu. We offer a flu vaccine every year because of the changes we see and the requirement for new vaccine. We expect the same here. But no country is currently going beyond 2 doses of the single vaccine.
Yes, that's correct. And no company has yet produced an updated version of their vaccine as yet. There's plenty of speculation, and I think most commentators are anticipating that with the emergence of new variants, there will be a need for future vaccines to be adjusted. But just how often people may need a booster shot is not yet clear.
I'm sure we're all closely watching some of the early data, even though in some cases not necessarily peer-reviewed research around the efficacy of the Pfizer, for instance, or other vaccines on some of the variants. At the moment, data is suggesting that it's holding up well, particularly with those 2 doses, as being really critically important. So that's something that, of course, we build into our thinking about making sure that we are following up and ensuring people have their second dose.
What's going to be the scope to go outside that age prioritisation?
Yeah.
Like, say if you wanted to go overseas, is there a chance to jump the queue for that, or do you have to still have the same quite high compassionate?
So at the moment we have criteria for people to access vaccine early for a number of different thresholds to be met, though, so compassionate grounds, of course, for those who may need to travel to represent New Zealand. And I think as ministers, as we start opening up, we'll keep under review whether or not we need to change that criteria.
So it could loosen up?
It well could. We will, as we see wider cohorts being brought in, we will look at that criteria and see whether or not it needs to be broadened as well. Another really important point that I know the Director General and I are very keen for to be amplified. Yes, we're running an age bracket system, but alongside that, we will be targeting those workplaces and those mass vaccination events towards those communities that it's really critical we reach. That will help us overcome some equity issues. We particularly need to make sure that our Māori and Pacifica population, where there are in some cases greater risk, are being vaccinated in a timely way, and also our rural and isolated populations.
So I wasn't sure what you meant about the workplace. Is it based on vulnerability? Because you said Fonterra, so is it also size? Or? Yeah,
so for one of the main considerations will be, is this a population that we may otherwise find it difficult to reach into? So we'll take into account whether or not in some vaccine sites, whether it will help us with rural and isolated populations, or indeed whether or not it will help us overcome equity issues. When you think about the way age cohorts will work, if you're leaving till the latter half, your younger population, you're not necessarily going to proportionately be reaching our different population groups in New Zealand. And actually we do need to make sure that we are vaccinating those high-risk groups, and we know that we have we absolutely need to reach our Māori and Pacifica populations, so we'll be using some of those mass vaccine events or work sites in order to lift that.
Dr. Bloomfield, what can you tell us about the
And then I'll come to you in the middle.
Sorry, the
Stewart Island?
Oh, the Rakiura case, yes. So, yes, we were notified yesterday of rather than calling it a case, a very weak positive result, actually, in a child, which was a bit puzzling, and this came as a result of pre-departure testing ahead of overseas travel, by testing of a family. All the other family members tested negative, and repeat testing of both the child and other family members was negative as well. We're awaiting some serology results on the parents just to see whether we can see whether there might be historical infection there. Most likely, we feel this is a false positive, but because it's an isolated community, and also we recognise there may well be a need to just provide reassurance in that community. The PHO and the DHB are mobilising some teams to go to Rakiura today to test other children in the daycare centre where this child attended, and also others in the community who may want testing. So everything points towards this being a false positive. We have had these before, including in children, but of course one needs to be just certain of that, so hence the extra testing.
Prime Minister, you mentioned that we need to be careful not to get too close to the targets. So we've been at about 107, 108%, but there are some DHBs which are, well overperforming the targets that they've set, and others that are consistently underperforming. Are the targets, as they stand, fit for purpose? Do these need to be revised?
I think probably the way I would express it at these is that ultimately these were for our planning purposes. So DHBs gave us indicative schedules of what they believed they would hit, and in many cases, as you've said, they're overperforming. And the reason that in the future, overperforming is something that we're likely to welcome, but right now, while we've got tight supply, just helps us with our planning around demand and supply if DHBs are sticking broadly to what they're indicating they're likely to do. So one of the issues, of course, has been previously, because we've had limited amount of time that the vaccine can be safely stored outside of the freezer, we've been using walk-ins to use up dose at the end of the day. Now we've actually got a bit more flexibility there. We've had approval now for them to be stored for longer periods, so walk-ins aren't as necessary. We're hoping that will reduce down some of that overperformance and mean that we're vaccinating those who are booked. My message to people would be, if you are booked in for a vaccine, nothing has changed for you. Continue to follow through on your booking. We're dealing with some of the demand and supply issues predominantly in other ways.
So will walk-ins be turned away?
We are discouraging walk-ins because actually there was a purpose to them previously that doesn't exist as much now, and it just helps us ensure that we can deliver to those who are booked in. It means they're also likely to be in those priority groups, and it helps us with the planning for now.
Maybe just I should say that as we move to the wider rollout, ideally we're wanting people to book, and that's why we've got a range of ways people can book. But there will still be other ways that people can be vaccinated, including through the mass events that the PM's alluded to, and also there will be capacity for walk-ins. But clearly it's much better for the planning and delivery if people have booked in beforehand. Then we know we've got the supply in the sites and the workforce in the sites to do the vaccinations each day. I'll come in here.
Given that your timetable to complete the bulk of vaccination is the end of the year, can you talk us through your timetable for adjusting the border restrictions?
Look, this is something that we continue to assess based on what we're seeing internationally, and helpfully, of course, there are some countries who are varying up their border restrictions, albeit they don't have the same approach to COVID as us, but they are varying up their border restrictions alongside their vaccination rollout. So that will give us a bit of an indication as to whether or not that can be done safely. I think what we can share for now, though, and we are asking our expert groups like Professor David Skeggs and his team to go away and consider what a vaccination rollout will mean for the way that we operate our borders in the future. So we're doing that work right now.
Have they given a number, Prime Minister, like, okay, 80% is the sweet spot for opening up for people from low-risk countries without MIT?
So we have asked for some of that modelling to be done, and with different factors. For instance, if you have pre-departure testing and arrival testing, how does that vary the way that you're able to work? And we expect some of that modelling to come through in the near future, and it's likely that that those who do the modelling will be sharing that directly. I think the most important 2 points that I would make, having a large proportion of our population vaccinated, as many people as possible who are eligible, gives us the greatest amount of freedom and opportunity. I think it's everyone's goal in New Zealand to live without a state of fear that we're going to have another lockdown. Now, that does not mean that we're going to have a situation where everyone will be vaccinated and the borders just one day will open. We will need to still have caution around our borders because of variants and because not every other country will be in the same position as us. But if we have as many as possible vaccinated, that reduces risk and it gives us a chance to change the way we do things at our border.
While you've given us an indicative timeframe for completing the vaccination in December, can you give
That's,
us,
of course, our plan. Everyone has a role to play in that.
But can you also give us an indicative plan for announcing something around the border or give us an indication of, okay, we expect to be finished vaccinating by December, so in October we'll start telling you what we think about the border?
Yeah, that's exactly what we're working to. So we're doing the thinking.
You don't know that date?
No, so we're doing the thinking now. Some of the modelling's being done now, and we're having some of our experts consider these questions now as well. Keeping in mind, you'll hear internationally that some of the thresholds people are talking about are still changing quite a bit, and so are some of the models at the border. So everyone is writing the rule book as we go. The difference for New Zealand is that we've got a different rule book to write. I think what everyone will want to do is maintain the flexibility we have. Once you get rid of an elimination strategy, or anyone chooses to get rid of an elimination strategy, it's very hard to come back to it. So for New Zealand, it's about how do we preserve our position whilst having a bit more freedom at the border. But I think the idea that any country in the world will suddenly turn off all of their measures at once, I don't think anyone's considering that.
Can you give me a definitive on whether you will expect people to be vaccinated in order to enter New Zealand?
That's not a decision that's being made as yet, but I was just recently looking at all of the border requirements globally. A large proportion of countries, particularly within the EU, are requiring vaccination.
Is that where you're leaning there?
Oh, look, I think New Zealanders would have an expectation that if they have made the effort to keep themselves safe by being vaccinated, that those who are wishing to visit New Zealand should show a similar sense of responsibility. And actually, it's becoming a global trend, so I think it would be very unusual if New Zealand didn't have some of those requirements. Keep in mind, it will hopefully give us more flexibility about the way we deal with managed isolation.
So what do you think about the fact that fewer than half of the over 65s in South Auckland, in Group 2, have had their vaccines?
I'll have Dr. Bloomfield speak to that. But one thing I would say is the over 65 group represents 1 million people. So that is a group that was going to take some time.
And the South Aucklanders that were in that Group 2, there's about 70,000 and only 30,000 have had their vaccines. They're a high-risk group.
Yeah, and look, as I've said, everyone, of course, our focus is that everyone who is eligible will have the opportunity to be vaccinated. Our goal has to be to definitely make sure we're prioritising those who are in high-risk areas. So we will keep making efforts through community providers and so on, and that will be an ongoing focus for us. There's no end date for that group to be eligible, and that's an important point to make.
Nothing to add, PM. I was asked about this yesterday. I think it's ongoing work in progress, and in fact, if you compare that with our overall population coverage, it's going up and it's at a good level and it's climbing every day, and there is an ongoing focus in that community.
This is where, for some of our mass vaccine events, for instance, we'll look at whether or not we've got enough uptake in those areas we need and use some of those events to really be quite targeted and try and get, family, friends, whanau to bring one another, because we know that makes a difference.
Have you booked any venues, Prime Minister? Can you tell us, okay, it's going to be Eden Park and it will be in...
We do have plans that are quite far along, but some of those events, I'd rather not do that right now, but we are quite far along in some of that planning. But of course, making sure that we have the supply that we need to keep our general rollout and then able to tack on those mass events. But as soon as we're ready, we'll certainly let you know. They'll be, it's by default, they're mass vaccine events, so they'll need to be capable of coping with large throughput.
And how many people might...
And so one other thing I'd add is that we've, actually the Ministry of Health has been fantastic in working with people who usually run mass events with large crowds in order to, build capability to be able to hold these events successfully. So we'll start by trialling and then see how they go and how we'll use them more broadly.
How many people might be vaccinated in a day at one of these events?
Oh, in the thousands.
With lots of people moving back to New Zealand now who have been vaccinated, is there any plans to put them on the register so we know what vaccine they've had or that they are vaccinated?
Yes, so when people, if they're shifting back to live in New Zealand, when they register with a healthcare provider, usually a GP, the GP would record that information in their medical record, and that could then also be reflected in the the National Immunisation Register, or the COVID Immunisation Register. Yes.
Are there any plans for like vaccine certificates, like what's being planned for Australia or other countries?
Well, we're very closely linked into the work that's being done through the international transport associations and all, because we've had versions of this before for other illnesses that you need to demonstrate some kind of protection against. That work is in train, and we're working closely with them, because our view would be, of course, we'd want to integrate their data and allow their data to be integrated with ours.
On age bands, Prime Minister,
Yeah.
Just a question from the gallery. Given that young people are more mobile than our older populations and therefore more likely to sort of spread virus around if we were to have it, why are we vaccinating them last?
As you will have heard me say right from the beginning, the vaccination cohorting is based on those who are at greatest risk from serious illness if they contract COVID-19. So that's a very simple reason, and you'll see we're not alone in choosing to roll out in this way. It's exactly what the likes of the United Kingdom, Australia and others are doing. But we will also be looking into other events that help us reach those who might be a little harder to reach, might take us a little longer to reach. So with that combination, we're confident that we'll have a really fair and equitable rollout.
Dr. Bloomfield, the over 65s who are getting the call out now in Auckland, they're getting a text message which is telling them to go online. Is that what they're using to book their vaccination appointments?
Yeah, not yet.
Okay.
The Auckland Metro region is using the system it's had in place right from the start, and because they have many, many bookings already on there, it's going to be the one that we will migrate across to the new system after all the other DHBs are on, because there's a lot of data to migrate across.
How's it coping? Because we're getting a lot of feedback from listeners, texts and emails saying that it locks them out of their accounts, they can't get past
They
the
can
code,
call.
and it's very complicated
Yeah.
in terms of getting on there to book. How's it functioning?
I don't have the detail, but what I can say is every DHB has a call centre, most of them an arrangement with Healthline, Whakarongarau, to help people who are having trouble making bookings. I think the key thing I want to emphasise here is we have been really, we've put a lot of focus on making sure our national booking system, when it comes online, has a lot of capacity, because it's great, there is a lot of interest, and we want to be able to cope with all that interest. But to back that up, there will also be an opportunity for people who either are not able to or don't want to book online, or who are having difficulties. They will be able to ring the call centre.
What's your confidence level around the BookMy Vaccine's ability to handle the kind of influx you're going to get?
Yeah, we've got a high level of confidence in that. The core system on which it's based, A, is in the cloud, so there's enormous capacity there, but B, it has been also used essentially in California already, and has been used to roll out over 14 million vaccinations through that booking system. So we're confident that it will be able to cope with the demand.
I'm just going to, and then I'm going to wrap up. So maybe the last two questions. I would call your name, but just all I've got is visitor to go by. So,
just building on those age bands, why haven't communities like Māori and Pacifica been specifically targeted? I know you mentioned that you're going to be looking to prioritise in a way those people who are more vulnerable, but why haven't they been specifically targeted in those age bands, i.e. people over 60 or 55 or whatever it is, but Māori and Pacifica over 45?
you'll see, I mean, and actually in some of the early focus, and we've had a question that pointed to the fact that actually we have had a particular focus, for instance, on our South Auckland community with that early prioritisation. One of the things that we've had to consider with the remainder of the rollout is just the simplicity of communicating to the nation that now it is your turn. But we are acutely aware that there are equity issues and that there are also groups that are at higher risk. We're seeking to overcome that by going in and undertaking vaccination of entire populations in some of our more rural and isolated communities. I particularly expect that to be the case in parts of the East Coast and Northland, and also the way that we use our large mass vaccination events, and also the way we use workplace events. So all of those will help us overcome some of the issues you've raised.
Those earlier priority groups, when they book people who are in group 1, 2 and 3 who haven't had their vaccination yet, will they be prioritised when they book, i.e. they will get in ahead of people?
Yes, so at the moment there's no restriction or constraint on anyone who's in group 1 or 2 from getting a booking, so they get prioritised. And likewise, as the Prime Minister said, it's open-ended even as new cohorts come on. So Group 3, of course, we want people to be booking in now and being vaccinated, but that won't finish at any time. I should say, just in terms of reaching Māori and Pacific communities, right from the start of the program, there has been a focus by all district health boards on enabling a whanau-based approach. So if older Māori or Pacifica people come in with wider family members, then the whole family can be vaccinated. And you will recall also right from the start there were vaccine doses specifically set aside for Māori and Pacific health providers to have access to vaccinate those populations, and that will be a continued focus. The district health boards are all required to have a very clear part of their plan that focuses on how they will ensure those communities are delivered to right across the age bands, but particularly as we go down through the age groups.
I'm mindful that you haven't had a question at the back. Sorry.
Sorry, just a couple from me. One, how do you feel about the 12 people who breached MOQ rules at the Crown Plaza?
Look, for us, the focus is on making sure that we identify how it is that those breaches occurred, making sure that those involved absolutely know what is expected of them. So you'll already know they've come from low-risk countries, but we want to make sure that we are very, very clear on the expectations and that we do everything we can to prevent other rule breaches.
Okay, just lastly, how are you feeling about being vaccinated tomorrow?
Good. Do you know, I think it'll actually be it'll feel like a really important milestone. I'm particularly looking forward to being vaccinated alongside Dr. Juliet Gerard. From the beginning of this pandemic, she's provided us alongside the Director General with such critical advice. And so it'll be, I think, we're really special to be able to be vaccinated alongside her. All right, last one.
Are you looking at doing more to help Fiji? Because things obviously have been great there at the moment.
So, two things. We've put $40 million of support from New Zealand into supporting Fiji in the midst and in the wake of COVID-19 and the impact it's having there. And we've also made a commitment around vaccine donations, but we've been in very close contact with Australia to ensure that together we are meeting their vaccine needs as quickly as we can. We've also made the offer to Fiji that if there is anything else that we can do, to just let us know, because we do want to support them at this really tough time.
And I think your officials have said they're going to get some AstraZeneca vaccine
So,
doses, but we don't have it yet.
So one of the issues is that we're unable to donate a vaccine or pass on vaccine until we have regulatory approval in country. So Fiji are aware of that issue. That's why we're working with Australia to see that they can meet need in the meantime. And so we're working very closely to make sure that that isn't holding back Fiji's rollout.
And why not give them some Pfizer?
My understanding is their request has been AstraZeneca, and I think it's because of that's
they don't have the infrastructure for that.
So that's their ask.
You as well, sorry.
Little cheeky.
I know. The Stewart Island case is there any chance that's a hangover from the blood cluster from all that time ago?
It's one possibility. We do know that during the lockdown period last year, we had probably quite a number of cases in the country that we didn't ever identify because we went into lockdown, transmission stopped. But there are some historical cases we have picked up in people who were clearly infected at that period, and this may be one of those, but it seems unlikely at this stage.
Serology will tell us. All right, we better call it quits. Thanks, everyone.